Hi, my name is Olivia Holmberg and I will be reporting on a patient today. The patient is 74 years old. The sex is a female. The marital status is married. The race is white. Her usual occupation is a retired RN and usual source of medical care is just a family doctor. Her vital signs are as followed: temperature 98.9 degrees Fahrenheit, pulse 72, respiration 17, and blood pressure 134/86. Reason for seeking care is headache and clear nasal drainage at the start, and then progress into sinuses being blocked and a cough. Her present history of illness is that it started on Thursday 3/3/16 with a headache and cough following on 3/4/16. The location is sinus and throat. The intensity is not intense. The duration has been 5 days. The severity is not very severe, and the frequency is a cough, runny nose, and headache all day. The quality is pressure in the sinuses and a scratchy throat. The aggravating factors is weather changes. Alleviating factors is ibuprofen and steam. The course of the problem has been runny nose, headache, and cough. The effort for the client to treat the symptoms have been steam and hot tea. There has been no interference with daily activities, and the client's perception of the problem is that it is only a common cold. Her health history is that she had a left hip fracture, left knee replacement, depression, and a birth defect that was fixed with orthopedic surgery on both feet, and she is lactose intolerant. She is up to date on all her immunizations and received a flu shot and pneumonia shot this past fall. She is only allergic to penicillin that results in giant highs. Her hospitalizations have been knee, hip, and feet surgeries and 5 pregnancies. The functional assessment is that she uses alcohol rarely. Her exercise is restricted by her hip. Rest and sleep patterns are good. Her nutrition is good, and she does not smoke. She does use caffeine with 4 to 6 cups a day, and use of safety devices has been rail on staircases and bathroom safety bars to help her get off the toilet and in and out of the shower. Family dynamics are that she is married, retired, living in own home, and has grandchildren and children. Her relationships are good. Her stressors are that she can't do things that she used to be able to, loss of some mobility, and needing help. Environmental hazards are snow and ice. Cultural and spiritual practices are that she is an active church member. Her educational level is some college, and healthcare is only yearly physicals. Her family history is that her dad died of thyroid cancer at 61. Her brother was diagnosed with type 2 diabetes at the age of 55. Her perception of her general health is that she is overall very healthy and she is very satisfied with that. She is very weight stable and within the normal ranges. She gets tired more than she used to, and she has not had any sudden weight loss. She has not experienced any fever, chills, night sweats, or excessive fatigue, and she has cold intolerance after her hip surgery and full knee replacement, and the cold is uncomfortable in these areas. For thorax, lung, and breast, I already talked about the chief complaint, but now I will talk about the subjective data. She has slight shortness of breath, and there is no sputum production upon the cough. There is no pain or wheezing when breathing, and her nasal drainage characteristics are that it is clear. For the objective data on thorax, lung, and breast is when I observed the thorax, the color was even with the rest of the body, and there was pink undertones. The AP transverse diameter was 1 to 2. The sternum was midline, and the clavicles were equal at height. When I observed her breathing pattern, there was slight distress in labored breathing, and there was 17 breaths per minute. When I palpated the trachea, it was midline with no deviations, and I palpated for expansion posteriorly, which was symmetrical, and I palpated for tactile fremitus, which was equal bilaterally. And then I palpated the ribs and thorax posteriorly, which was symmetrical side to side. The scapula were at the same height. There was no tenderness on the vertebrae, and the muscles were smooth and firm. When I auscultated all lung fields anteriorly, they were vesicular over most areas, and the lung sounds were clear. Next, I auscultated the lung fields laterally where they were all clear, and then I auscultated the lung fields posteriorly, which had a slight wheezing. Bronchophony, the sounds were muffled. Egophony, the sounds were muffled, and I heard E over A. And whispered pectoraliquy, the sounds were not audible. Musculoskeletal chief complaints was that the date of onset was 1/22/15. The location was the hip. Intensity was post-operative. Severity was fracture. Aggravating factors were cold, if she was on her feet too much weight bearing, and stairs. Alleviating factors was rest and elevation. Precipitating factors were too much activity or not enough rest. The course of the problem was first no weight bearing, then could walk with a cane and now walks with a limp. The treatment has been exercise to strengthen the leg and hip through physical therapy and increased weight bearing. Interference with activities of daily living is that it slows the patient down, and the activities of daily living are slower and more awkward. Associated symptoms are pain in leg and balance is poor. Musculoskeletal subjective data is that there are joint pains in the hip. Swelling was yes after surgery. There is no redness, warmth, or deformities. The limitations is in range of motion is in the hip and left ankle on left side. Limitations in activities of daily living is cannot do as much as used to. Weakness, yes, in left leg, and there is no history of arthritis. Musculoskeletal objective data. I first assessed the muscle mass and bone structure, and it was even bilaterally. The posture was erect, and there was a slight limp in the gait. I next assessed for scoliosis, which there was none, but her right side of her body was higher than the left. The TMJ joint was good. The neck was good. Shoulders showed a slight click in the right shoulder. The elbow, wrist, and fingers were all good in range of motion. For the hips, the left hip could not internally rotate and could barely flex and extend, but the right was good. The knee was good. The ankles, the left ankle could not evert and invert, but the right was good. The spine was good. For muscle strength, the deltoids, biceps, and triceps were equal bilaterally. And the wrist, the right was stronger than the left. The fingers were equal bilaterally, and in the hip, the right was stronger than the left. For the hamstrings and quadriceps, they were equal bilaterally, and the ankle, the right was stronger than the left. Next, I will talk about the pertinent assessments that I chose. First was abdominal assessment. The patient is lactose intolerant, so it is important to assess the abdomen because of the intolerance to lactose products, which can cause discomfort in the lower abdominal region. According to the article on lactose malabsorption and intolerance in the elderly by Stefano and others, it is important to assess the abdomen because of hypolactasia being responsible for lactose malabsorption, which can cause symptoms such as abdominal pain, bloating, flatulence, diarrhea that is evoked by milk consumption. The next assessment that I chose was HEANT. The patient is experiencing cold-like symptoms, so it is important to inspect the head, eyes, ears, nose, and throat because there may be indications of cold throughout these areas. The individual complained of coughing, mostly in the throat area, and indicated that she had clear nasal drainage from the nose. According to the article Cough and the Common Cold by Dr. Melvin R. Prater, it is important to assess head, eyes, ears, nose, and throat because the common cold is believed to be the single most cause of acute cough. A cough causes a direct irritation of the upper airway structures. It is also clear that viral infections of the upper respiratory tract that produces the common cold syndrome frequently produce a rhinosinusitis. Thank you.